Dr. William Samoei Ruto, Party Leader ANC, Honorable Musalia Mudavadi, Party Leader Fort Kenya, Honorable Papa Waroma, due protocol observed. Good afternoon. Indeed, I hope the Speaker who has just left will be one of those who will be nominated to Parliament. Your Excellency, I have been following these proceedings as I come on my way, and I've had some of the questions, the issues you have been raised. And one of the issues that has been raised is what has county government been able to do that is good and that should be maintained. It's very good when we critique a system, we look from the both sides of what that system has given us. I will begin by saying the good things about devolution. Devolution is good. It's not bad. We must agree. For example, the areas where devolution has improved in the health sector is the issue of increase in healthcare facilities. We have seen tremendous increase in healthcare facilities after devolution. Of course, that is the area where many politicians, especially the governors, will want to see structures. And they'll want to see the electorate that, look here, we have a facility here, we have constructed this, we have constructed this, but that facility is not enough. There is what goes into that facility to make it a functional healthcare facility. Another area that the county governments have tried is to increase the number of basic healthcare workers. I will admit that at the national government, the last hiring that took place before devolution was 300 nurses across the country. Machakos County government alone hired 800 nurses in 2017. And that must be recognized. Another area that the county governments have done very well is to increase the number of equipment through the management medical equipment scheme. We have many equipment, many hospitals, at least 2 hospitals in every county have those equipment. Also, again, the problem comes with the human resource, which I'll come to it later on. Now, as a healthcare leader, as a trade unionist, what are the challenges that have come along with the devolution that we think need to be resolved? Because every time we mention about the Health Service Commission, all the governors will come gun blazing. I will not be mentioning the word Health Service Commission, but I'll be mentioning the areas that I think should be addressed. And if in the process of trying to address this issue, the solution will be the healthcare system, so be it. One of the areas, Your Excellency, when I came to my office this morning, I got a brief from my employees, and I was told that there was a strike in Embu that ended over the weekend. And I wanted to know what it was for, because I was not even aware as the General Secretary. And they told me all health workers, doctors, nurses, clinical officers, physicians, everybody had gone on strike because Embu County government has not been remitting statutory deduction for the last, 1 year or so. It means those health workers cannot even access healthcare services because the NHIF deductions have not been remitted. And the strike ended over the weekend after the courts gave the orders. So what are we saying? We are saying that health workers have gone on strike so many times, not because they want salaries to be increased, but because salaries have not been paid. We have some counties where salaries have been paid and others have not. So many of the 85% of the industrial action in this country have been occasioned by non-payment of salary in most of the counties. Non-remittance of statutory deductions. There is also the case of discrimination occasioned by tribalism, nepotism and clanism that has already been explained, I think, by Dr. Thuranira. I saw it online when I was coming. Funding of healthcare remains a major challenge. For example, the Constitution requires that every health facility in Kenya must offer emergency health care to every Kenyan or every person who goes to that facility, for example, after a road accident. But the question is, Who funds this emergency health care? You come to my health facility, I'm a private practitioner like Dr. Timothy Olwey, and you have an accident and you go there. He's supposed to give you emergency health care until you stabilize. Who is going to pay for this? We must have a system where a fund is developed, regulations and policies are put in place so that emergency health care is funded. We also have a challenge. When the primary health care was destroyed, and it has now been replaced by community health volunteers who are now taking care of the functions that were taken off by public health officers. You know, when I was a small boy, my mother in the shop there would say, "Mtu wa porafia anakuja na tutafunga mlango." The shop must be closed so that mtu wa porafia asishike mama. I didn't know that the porafia person was to make sure that we have a toilet, our place of work is clean. So that responsibility has now been taken over by the community health volunteers, who we recommend strongly that they should now be turned into community health workers and be paid something for doing that noble work. We have heard explanation on how healthcare is suffering in terms of specialized training. County governments are employing basic healthcare workers. Those, if you are a nurse, you have a first diploma or a degree. If you are a doctor, they're employing with a degree. But when it comes to specialized healthcare workers, is where you have a challenge. That has already been explained, and I need not to repeat it. We have also had the issue of lack of medicine, has probably been explained. Unequal promotions. I'll give you examples of two counties that have done very well. When you go to Kiambu, our union has spearheaded at least 4 promotions from the day devolution took place. But in other counties, we have 0 promotions. So we have health workers in Kenya who are enjoying, like in Kiambu, and we have other health workers elsewhere where promotions has not taken place. Because these are the issues that lead to disruption in healthcare services.
Iwapo unapenda habari nazokuletea, basi subscribe kwenye channel hii ili uwe unapata uhondo kila wakati. Shukran.